Hello, 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 and welcome to this caregiver preview for STI, BBI literacy. I'm Christy Abel, and it is with great pleasure and a great honor that on behalf of Rethink Sex Education, I offer you the following information in regards to STI literacy. But before we begin this session, I would like to recognize and appreciate that I am an invited guest in the traditional territory of the Tsawwassen and Musqueam First Nations. I have the privilege to work, learn, play, and live in this beautiful place, and I'm committed to being a steward of this land. I express gratitude to the Coast Salish community and all Homohoyan-speaking people, and offer my respect to all of the elders who've gone before us and First Nations people who are with us today. And I encourage you to do the same wherever in the world you may be. Haishka. So who am I? And why should you listen to me? Well, first of all, I am very, very well educated and prepared for this position. So I'm a certified sexual health educator through the University of Alberta. I have a master's degree in counseling psychology from the UVic. I have a Bachelor of Education degree with the UBC, and it all started way back in 1994 when I started my bachelor's degree in English literature, also at UBC. And I have a ton of experience. So I was a high school teacher shortly following that Bachelor of Education degree from 2001 to 2009. Then I decided to expand into the world of counseling. So I got my master's degree and still currently do this work. Actually, I really, really love working with young people. I find it to be an honor to be a trusted adult for them in the building, and hopefully I will be a trusted adult in terms of sexual health education for your child and or for yourself, right? Because guess what? STIs, they're for everybody. All right. For 3 years, I was the district lead for sexual health education in my school district, and I'm so grateful for that experience because it's what got me to get certified, actually, to be able to do this. So I'm very grateful for that position. And I am indeed the founder, director, and CEO of Rethink Sex Ed, which was incorporated in 2021. And here we are in the present with that still going. I am the mom of 2 awesome kids who both identify as male. I'm an animal lover. I've got a wonderful partner there as well. I'm a baseball coach, a volleyball coach, done a therapy practice on the side. I am now a YouTuber. I also love kayaking, hiking, being outside, all that kind of stuff. Okay, so who is this presentation for? And it's very interesting because initially my instinct was 12 plus. I would typically teach this in grade 8 or grade 9. However, when I dug into the benchmarks of what is suggested, it's actually 10 plus. So that is something that is very interesting. However, that being said, the caregiver, parent, guardian, is going to be the gatekeeper of this information. I'll explain a bit more about that afterwards. So it's also for people 10 plus. It's also for anybody who is sexually active at any age, because anybody can contract a sexually transmitted infection. And there's actually a particular need for STI education amongst older adults. So the rates among adults age 65 and older have more than doubled. I would say they are skyrocketing. And part of this is because older adults are living longer and enjoying active sex life thanks to medications for erectile dysfunction and vaginal dryness, as well as there is, I think it was called a silver divorce, where a lot of people are getting divorced and then having in their later years, and then expanding into the world of sexual activity, and sometimes with multiple partners. So we have to be, so you might want to give this to your grandma. Okay. They're also, the older population is particularly at risk because they are typically past childbearing age, especially those with a vagina and vulva. So they're not concerned about pregnancy. So, but STIs, again, they for everybody. Okay, here's a little hint, just the national here. So I'm in Canada, so I do take a lot of my resources from Canada. However, I found when I scoured the web for a good way to make this point, this was the best one that illustrated what I wanted to say. Oops, if we get to it.
This may be awkward. STDs in seniors have risen 70%. Eye-popping in more ways than one. But you got the message.
I got the message.
Yeah.
Oh, yeah. The ending is very clever.
The ad's American, but health experts say the problem isn't.
Maybe when they were younger, the risk was getting pregnant, and that's not a possibility anymore. So they think there are no risks.
The Public Health Agency of Canada says reported rates of sexually transmitted infections are increasing for all ages. Many older adults are more sexually active thanks to potent pills for erectile dysfunction and hormone creams for women. Others blame the rise of online dating apps and declining fears over HIV.
A lot of times it's, I didn't know I could get this, or I thought the person was okay. I didn't think we needed to get testing.
Health officials in Alberta are reporting outbreak levels of gonorrhea and a doubling of syphilis cases. Among women, STI shot up 93% last year over the year before. And Ontario is reporting a 30% increase in gonorrhea cases since 2013.
There's a lot of overwhelming feelings of, anger and blame and who gave this to me.
The highest rates of STIs are still among those aged 15 to 25. An infection can cause infertility and be passed on to an unborn baby, but the health impacts for older people can be devastating as well, weakening their immune systems. Still, there's very little sex ed for seniors.
And that's something that we might think of for our children, but we don't think about it for our parents.
Some hospitals and retirement homes are offering sexual health information for residents. The basic message, it doesn't matter how old you get, don't forget to suit up before sex. Christine Burak, CBC News, Toronto.
Great, and this this screenshot that we see here that the National is using is actually from a public service announcement in Florida, where they are seeing it's a big place for retirees, and they're seeing a huge influx in STI contraction. So something to consider. I don't want that. I want this. Great. Okay, so now from the World Health Organization. Now these are actually from 2014, because that's the last time they typically do like a big load of data about every 10 years. However, so what we can basically assume is that this has got, the numbers have gotten bigger, okay, because that is, this is the trend that we're seeing right now. So more than 1 million sexually active STIs are acquired every day. Every single day worldwide. And most of are asymptomatic. Now, when I go over this in the main event presentation, I'll go over what I'm going to break down everything. Okay. Every year, 374 million new infections in one of these 4 curables: chlamydia, gonorrhea, syphilis, and trichomoniasis. Now, more than 500 million people, 15 to 49, are estimated to have the herpes simplex virus. And all of these are, by the way, all these 1s, 2s, 3s and stuff, they're all quoted. These, anytime I give a stat, I make sure to back it up. So you'll see those quoted in the description, okay? The HPV infection is associated with over 311,000 cervical cancer deaths each year. Almost 1 million pregnant women were estimated to be infected with syphilis in 2016, resulting in over 350,000 adverse birth outcomes. And they have, STIs have a direct impact on sexual and reproductive health. And through the stigmatization, I will talk about stigma and why we need to move through it in order to go get tested, right? Infertility, cancers, and pregnancy complications, and can also increase the risk of HIV. And now there is some, in particularly, there's a type of gonorrhea that is now drug resistant. Okay, so this is very problematic, which is, yeah, it's a threat to reducing the burden of STIs worldwide. Okay, so SciCan, right, is the Canadian kind of I would say overlord. That's really not what it is. They're the boss. Okay. They're the boss when it comes to sex ed. And they've recently come out with a bunch of benchmarks. They're in the process of doing them for almost everything to do with sexual health, but they came out with STIs because STIs do indeed pose the greatest cost to our healthcare system, that kind of stuff. So these are the benchmarks for age 10 to 12, which is why I decided to reduce what this presentation for 12 plus and reduce it down to 10. Okay, so in this, they are to young people are to understand that many STIs do not have symptoms, about where they can get testing within their community, understand that there are different types, right? And then they have different symptoms and health outcomes, that regular testing is needed once a person becomes sexually active, and understanding the importance of STI testing for survivors in the cases of a sexual coercion or assault, also be provided with confidential community and school counseling resources, understand their diagnoses and treatment, understands how they can impact a person's physical and emotional health and well-being, understand that they may differ depending on the type of sexual activity, right? I will go over all of this, by the way, with the exception of where you can get your services locally, right? If I was to be doing this in like in my neighborhood, I would provide those, but this is the World Wide Web. So you are going to have to figure out that part on your own. And in different countries, there are different styles of where, like, names for organizations. So like, for example, in the States, it's called Planned Parenthood. In Canada, in BC, it's called Options for Sexual Health, right? So there's just different, you just have to research where you can get confidential sexual health treatment. But even like the family doctor can do it and hospitals can do it. Like lots of places. Okay, then we also want to understand, they need to understand the social and cultural factors associated with STI risk and prevention, and then how stigma and stereotypes impact people's lives. Lastly, understand harm reduction strategies, including PrEP and PrEP, which are both HIV treatment and pre-exposure drugs. Understand how to get the testing and treatment, and address information, motivation, and behavioral skills, which is the IMB model that I learned all about in my education for sexual health, how to disclose status and when to get tested with a partner. Okay. And then lastly, understand to the extent in which different contraceptive methods do or do not protect against STIs. And I would cover that also in my contraception presentation, which I will link below as well, contraception literacy. Okay, but it's not just SciCan, all right? So I work in British Columbia, so I went and took a look at the grade 6 PHE community, which is physical health education. Okay, so by grade 6, so age 10, 11, 12, okay, practices that reduce the risk of contracting sexually transmitted infections and include gonorrhea, chlamydia, and herpes, and there's a link there. Okay, and then SICUS, okay, which is the Sexual Information and Education Council of the United States. They are saying by the end of the 5th grade, so that is about age 10. Right, so between 9 and 10, no, 10 and 11, okay, define STDs, including HIV, and clarify common myths about transmission. And then by the end of 8th grade with SICUS, right, so we can read through these, right? They're basically the same as the Canadian ones, except the Canadian ones just have a bit more detail. But here we go. So you can find that under advocatesforyouth.org. And I will indeed put the link there so you can go explore that. It is a lengthy document on these national sex education standards. Okay, so we're going to wrap up the caregiver portion here. Okay, so I believe that the primary source of sexual health education should come from you, the caregiver, parent, guardian, etc. I want you to vet this, right? Like, and if for some reason, when it comes to STIs, most parents honestly they want their kids to know. Okay. So but I respect if that's not for you, right? So please go through the presentation, decide whether or not it's in alignment with what you want to share with your kids or your grandpa, right? About whether or not it's for you. But I don't consent. Your kids should not be seeing this in school. They should not be seeing it any type of after school program without my explicit written consent. Therefore, if your kid has stumbled upon this, right, it's not on me, is what I am saying. All right. I just wrapped up the pornography one earlier today, and it's like I talk about some safe search settings, right? So when I create these, when you go to YouTube, you have to click on the first page to upload. Yes, it's made for kids. No, it's not made for kids. Even though my target audience for here is 12 plus, I'm still going to hit not made for kids. So then, therefore, if your settings, right, on their safety settings are there, they're not going to come across it, right? And your little ones aren't going to come across this, but we do want them to get the information when it's time. Now, we really, 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 really need to get it to them before they're sexually active. Okay, that's really, really important. Okay, so now on the flip side of that, if you do find that what I am sharing is valuable, please like the channel, subscribe to the channel, share the presentations with other parents, guardians, and caregivers who you feel could benefit from the information. Let them make their own decisions, of course, but share it, please, 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 because it's only the way that we can move forward with creating a culture of consent. I really appreciate you taking the time to consider what I have to offer.